And here with me today, we have Amanda Lynett. She is a registered dietitian from the Division of Gastroenterology and Hepatology at Michigan Medicine. She's the lead GI specialist who deals with areas of nutrition and diet at the University of Michigan, is also the co-director of Food, the Main Course to Digestive Health. It's an annual GI nutrition training program for healthcare practitioners. We'll cover many topics today. First and foremost, the causes and daily impact of IBS bloating and abdominal pain, dietary strategies that reduce symptoms, identifying trigger foods and applying elimination diets. Also, the clinically validated IBS inFoods test, which applies personalized dietary guidance for people with symptoms, and long-term IBS and diet management for these folks. So Amanda, first question, what are some of the causes of bloating and abdominal pain in IBS patients?
So there's a lot of different diet and lifestyle causes that I can go more into in a second, but some of the other causes would be things like stress, other underlying GI conditions like SIBO could be playing a role. Definitely altered GI motility. I would say constipation tends to be one of the most common causes of bloating in my IBS patients. Other things like hormonal changes could be playing a role. From a dietitian's perspective, I definitely am looking at more of those diet and lifestyle factors. So with like swallowing too much air, is that causing more bloating? Are they eating really quickly? Are they chewing gum, drinking a lot of carbonated beverages, eating really large volumes at meal times, or going long periods in between eating? That could be playing a role.
Okay, thank you. And are there any normal foods that cause bloating or even sometimes pain? But when do people have to worry? And also, is bloating always bad?
Yeah, so this is definitely something I tried to explain to people, that some mild bloating or distension is normal after eating certain types of foods. So there are certain fermentable carbohydrates that can cause a little bloating after you eat them, and then a few hours later, that bloating should go away. An example of this would be beans. I feel like we all get a little bloated after we eat some beans, and the bloating will go down a few hours later. Now, other examples of this would be things like lactose, really high fiber meals, sugar, alcohols could do this and too much fat in a meal, like a high fat meal. The difference, or when someone might need to worry, is that when it's starting to impact their quality of life, or it's lasting more than a couple hours, or they are so, distended and bloated that they have to unbutton their pants, or the pain is so severe that they have to go lay down and they can't move. So that's where the difference really lies.
Okay, and then any indications of normal versus that abnormal bloating?
Yeah, so there is something I always like to tell people with bloating to kind of decipher the two. Thinking about bloating, which is a subjective feeling, versus distension, which is literally the objective, like increase in diameter. Some patients can have bloating and distension, but they don't always go together. And I think it's important to understand the difference, because some minor distension, again, happens naturally when you consume certain types of food. Trying to understand the difference, I think, is important to, do you wake up feeling distended already or bloated the minute you wake up? Or does it get worse as the day goes on? Does it only occur, after you eat a meal or after dinner time? Trying to better understand like the timing, the frequency. Does it happen daily? Does it only happen, if you haven't had a bowel movement in 3 days? That can really help us for getting down to the root cause.
Thank you. And obviously being aware of the different aspects of this presentation are important for the patient. And also to point out, this is obviously something that a lot of people are experiencing on a regular basis. And so what do you see as some of the impacts of bloating and abdominal pain on daily life?
Yeah, it can be very impactful, especially in my IBS patients. I mean, I see patients uh, completely changing their lifestyle, their eating patterns. They'll go all day without eating and wait till they get home from their workday because they don't want to be uncomfortable during the day. They are skipping social events that are surrounded around eating because of fear of abdominal pain. It can it can impact you emotionally. It can impact your sleep. So it bleeds into kind of all areas of life, and there's actual research that supports that. I mean, there's research on IBS patients and their productivity, and it shows that IBS symptoms, which most common was abdominal pain and bloating in the study, impacted on average about 8 days a month, which is large. And I think it said it about 1.5 days of missed work a month, which is also very impactful on your quality of life.
Thank you. People are having obviously significant impacts and coming to you and the practitioners in your office to find out what they can do about this. And so, what kind of things do you do to treat bloating? Is there a one size fits all kind of a solution for them?
Yeah, so from a dietitian standpoint, it's so individualized. It is definitely not one size fits all. And I think sometimes that can be frustrating for patients because they want to just have a magic pill to fix things. But as a dietitian, I am looking at that diet and lifestyle aspect of it, but I also need to know the big picture of other things that could be going on. Understanding their bowel habits is really important because we want to make sure that they are having regular bowel movements. I am assessing their fiber intake and perhaps, adjusting that to help treat it. Their hydration, are they drinking enough fluids? Their meal timing and their meal patterns. Also looking into some dietary triggers. So are they consuming a large amount of sugar-free products? Like, are they chewing gum all day long that contains sorbitol and that could cause some bloating? Or lactose? Like, are they eating a lot of dairy products with high lactose that is causing some abdominal pain? So those are just some of the things I assess. And as you can see, there's not one treatment plan, but some general, like, recommendations that are go-tos for me that are non like food related would be things like using enteric coated peppermint capsules, other digestive enzymes that are specific to those fermentable carbohydrates. Um, Other things would be things like going for a walk or movement after meal times. That can be so wonderful with reducing bloating. A light abdominal massage, a warm bath if they're having a lot of pain, uh, diaphragmatic breathing. I know I touched base earlier about like a little bit of stress, but diaphragmatic breathing can be really helpful, especially around meal times to help with like getting in the moment, focusing on what you're eating, and not being too revved up going into the meal, which might make you eat quicker and what might lead to more bloating.
Okay, so it sounds like there are some general approaches that most patients could apply, but also you had mentioned foods. And so, how do we find these foods that are triggering their bloating or even their abdominal pain?
Yeah, so there's like the old school method where you sit down, you get a big long diet recall from someone, you ask them to keep a food log, and then you can like hand pick things out. But there are other like formal elimination diets. There is the low FODMAP that is obviously the most evidence-based and well studied for IBS patients that have shown to improve symptoms from anywhere to 50 to 80% of our patients. So that is a form of elimination. And then other more targeted approaches like the inFoods test is an option to be more food specific with identifying their food triggers.
Okay. Can you tell me a little bit more about elimination diets and how does this work?
Yeah, so elimination diets aren't like a lifestyle change in the sense of it's not something you go on forever. It is just one part of the puzzle. The goal is to help you identify what is your trigger and what you tolerate. And it's meant to be followed short term, and then you slowly reintroduce foods and see if it worsens your symptoms. So it is elimination diets aren't you pull this food out of your diet and you never eat it again. There's a predetermined length of time that you follow it. And then typically we recommend to work obviously with a dietitian to do some kind of formal reintroduction.
And how long do they normally follow a diet like this? And does it change person to person?
Um, it can vary, but typically we say anywhere from like 4 to 6 weeks. I would say that's like the average. Research has been found anywhere from like 2 to 8 weeks where elimination diets can be done. I definitely think patients need to go longer than a week. So if someone's come to you and said they've already removed lactose for 3 days or for a week and they didn't notice a difference, I would challenge them to do a little longer of a period because a lot of other factors could be playing a role in that 1 week. Like I said, hormonal changes, maybe a really stressful week at work. They were traveling, so their sleep was different. So typically 4 to 6 weeks.
Okay. And are these hard diets or complex diets to follow? And what do patients say about them?
So I think it depends on the individual. If the individual already notices that some of their IBS symptoms, their bloating, their abdominal pain is associated with eating, I think that it's easier for them to be motivated to want to follow it, right? Like they have a little bit more of a buy-in because they associate their symptoms with eating. I would say one of like from a dietitian standpoint, one of my biggest concerns is that we're trying to prevent any nutrient deficiencies and make it clear like this is not a weight loss diet, that is not the goal. We are not trying to cut, back on total intake. We are trying to find ways to swap it out so you're still getting a nutritionally diverse diet. Um, Depending on the type of elimination diet you're doing, there can be a time commitment with like label reading and preparing foods, depending on the extent of things that you're pulling out of your diet. But in general, I feel like the feedback I get from patients is really positive because they do notice a difference, they notice an improvement in their symptoms, and they don't have to lean on the medications. They might not have to rely so much on like their bowel regimen because they're able to regulate their bowels more, which is reducing their bloating by removing certain foods. So those are the patients that I feel they feel it's much easier to follow and they're like more motivated in the process.
Okay, thank you. And you had alluded earlier to a more possibly targeted or personalized approach applying the inFoods IBS test. I know that we obviously did a study that was published last year. What is your perspective of the study, and have you had personal experience, in real life with this test?
Yeah, I think the initial study was very interesting and motivating because it's different than, I mean, the in-foods testing is different than your traditional like food sensitivity tests. It's more specific to IBS patients. And also I found really interesting in the results that there was improvement more in our IBS-C patients where things like the low FODMAP diet has been studied and proven to be more beneficial for IBS-D patients. So I found that interesting. And now, I saw recently the real world data that we have. So it's just more reinforcement to hopefully utilize it more. I would say with my experience with it, it has been just another tool for my toolbox of things to offer patients when I do the proper, dietary history with someone and really assess and do the shared decision making with them. I provide that as an option, if their lifestyle, if they're super busy, they don't have the ability to pull out a ton of foods and follow something like the low FODMAP diet, this is a great, more targeted approach where hopefully they can find relief much quicker than having to, like I said, remove things for a month and then systematically reintroduce things.
Okay. And can you tell us a little bit more about how you interpret the results and how you apply these to patient management?
Yeah, so there's 18 foods that they're testing. and it comes back, you either have like a positive food, which means that the IgG level is elevated, or negative means there's no elevation, which again is different from some of the other food sensitivity tests that are out there where you have like these different levels and it shows moderate and stuff, which are really hard to interpret. I think this is pretty like clear cut, of like these are things you should be avoiding, and then these are things that are okay to include. I tell people, like, let's say something came back negative and it was lactose, but you're already aware that you have issues with lactose, and it wasn't one of your positives on that. It doesn't mean you have to put the food back in. It just means that in the sense of this, like IgG level, it is not coming back as a response. And for this reason, you don't have to avoid it. But if you feel like for other reasons it is causing issues, obviously avoid it. Or same with like some of the foods could be like lemon, for example, could be like a reflux trigger. If it's negative, don't put it back in if it's going to cause reflux for you.
Okay, thank you. And can you tell us a little bit about the differences between this inFoods approach and then also the low FODMAP approach? And do you combine these ever?
Yeah, so I think the main difference in this, how I explain to patients, is like the low FODMAP diet is we are blanketedly removing a bunch of foods in these different categories. So the low FODMAP has 5 different categories of these short chain carbohydrates where we're removing these foods, like I said, anywhere from like 4 to 6 weeks, and then we're systematically putting them back in your diet. So it's a large volume of food or like variety of foods that you're removing, and then you're slowly putting them back in one at a time to identify what is your trigger and what is tolerated. Where the inFoods testing, you do the blood work, you send it, you get your results. You are only removing up front the things that are positive. So you're not doing that, like, I guess you could say, like guessing game or that blanketed removal up front. You are going straight into removing what should be your trigger and then continuing to eat the things that were negative. Now, just like what I was talking about with the lactose, I mean, that is something that's also high FODMAP. So if someone has some FODMAP sensitivities, you could pair the two together, but you want to make sure you're not applying them at the same time because you want to identify like which approach is actually giving symptom relief. You never want to do 2 treatment plans at the same time, 2 diet plans at the same time. So I would do them separately. But if someone already came to you saying they've done the low FODMAP and they've identified, garlic as their trigger, or lactose as a trigger, and they're still having symptoms, inFoods would be a wonderful option for them to then trial rather than put them through the low FODMAP diet again.
Makes sense. Thank you. And so you talked a little bit before about the impact to these people's lives and the significance of that. And so as you're working through an elimination diet or applying inFoods, do you have recommendations or advice on how we can make this easier for them around eating, feeling comfortable, looking for the right foods?
Yeah, so I think this is where a dietitian can be really helpful because it's important to kind of understand how to navigate like label reading to identify your food trigger and the different words it could show up as. If wheat is one of your triggers, all the different terminology it could like show up on a food label, understanding that. When someone is going out to eat, better understanding how to like navigate dining out, questions to ask is important. I tell people all the time to review the menu beforehand. Do they even mention any kind of allergen on the menu? And if so, great. That kind of gives us an indicator that they are able to maybe modify meals. And then from there, asking a lot of questions like, is this prepared in-house or is this something you got elsewhere and it's already pre-seasoned? So they're unsure if it contains garlic or onion. Asking different questions. Is it prepared? Like, are you using like a shared fryer and wheat is your allergy and they're also frying chicken tenders with their French fries? Those are good questions to be thinking about when dining out. Other advices I tell people, like, it's not like an all or nothing approach. So like trying to reduce your overall load of your trigger foods is the most important part. Don't beat yourself up. Like, again, we don't want to create more anxiety when going through this process. So don't beat yourself up if you accidentally consume something or you get trace amounts. It's impossible to completely never, ever have a trace amount of some of these foods in your diet again. Our goal is to reduce how much of it you're consuming. I think having like allies, having people to support you can be really helpful. When you're going out, like if the whole idea of even trying to navigate dining out sounds stressful, trying to find ways to do other activities, I encourage people maybe meet a friend for coffee rather than lunch, or going for a walk rather than something that's surrounded eating around eating. Other things like advice that I tell people when going into this elimination or removing these foods from their diet is try to simplify it. Try to do batch cooking. If wheat is your trigger, utilizing a gluten-free grain and maybe batch cooking it on Sunday. I don't know, we'll say gluten-free pasta and rice and quinoa as like a couple alternatives. Maybe batch cook those. And so then when you're cooking dinner for the family throughout the week and they want spaghetti, you already have your noodles prepped and you can just quickly heat it up so you're not having multiple dishes at that particular meal time. Can be really helpful. Batch cooking also means you can then have leftovers, which makes things easier. Thinking ahead of your week and what you have going on can help you navigate how to meal plan and meal prep. And sometimes like it's easiest just to keep things simple, like focusing on having a balanced meal where you're getting some kind of protein, a fiber source, a healthy fat. You don't have to make it too complicated. Like keeping it simple can be helpful.
Those are all really good recommendations. Thank you. And super practical to implement. And so obviously these patients have been dealing with these symptoms for a long time, and you'll be working with them to reduce the symptoms within their life. And just wanted to hear a little bit more about possibly a long-term plan, or how do they manage their symptoms going forward?
Yeah, so long-term plan, like if they've identified those positive foods are in fact like a trigger for them and they feel better without it, building some kind of sustainable routine they're making sure they are replacing whatever they're avoiding, so they're not going to have any nutrient deficiencies. Again, if milk is a trigger and they're pulling that out and dairy products out of their diet, are they getting calcium from a dairy alternative source? These are long-term things we need to be thinking about. Or if garlic is a trigger, but someone truly loves the taste of it and they cook with it all the time, could we utilize garlic infused olive oil? Like these are things you could do in the short term, but also long term for the quality of life standpoint. Or the green parts of like green onions, like utilizing that still gets you that wonderful flavor. Um, you know, I already talked about like having the support system, having people around you be aware of your triggers can be helpful too, because I find people are usually pretty happy to like, oh, I saw this at the grocery store and I thought of you. If you tell someone, right? Like they're like, oh, I saw this and I thought of you because you said you can't eat any dairy and I found this dairy-free product, and they might end up buying it for you. And just having people make you feel more included. And I think food is so social, so that inclusion is really important. Um, Also like finding different naturally like cost effective ways in the long term. Like during the short term, it might be fun to buy all these fancy like prepackaged items that don't have your trigger in it, but in the long run, like is it cost effective for you, or should you be leaning more on natural alternatives? Like if sugar is a trigger for you, it might be in the short term easy to buy some like sugar alternatives for baking, but in the long run, a mashed banana is going to be much more cost effective when you're baking than maybe some of these sugar alternatives. So thinking about things like that. in the very beginning, I talked about how all these different factors can play a role in bloating and abdominal pain outside of just what we're eating. And I do spend a lot of time with my patients talking about just like the big picture of thinking about outside of like so hyper focused on what food is causing it, but like, are you moving your body throughout the day? Are you sitting in a chair with all your internal organs and your bowels all bunched up all day long? That's not going to help with motility at all. Talking about stress management again, like, are you feeling really stressed out? Do you have too much on your plate? Can you do some meditation? Like, can you reach out, do some journaling? Like, finding ways to help them navigate those things can be helpful as well. And like sleep is another big thing I tell people can play a huge role on all of this. So I do find sometimes I spend a lot of time with my patients talking about the roles of like just being mindful at meal times, those mindfulness practices. Are you drinking enough water? Just I spend just as much time talking about these things with my patients sometimes versus like that one food item that is triggering their symptoms.
Makes sense. And all the things that really flow into the complex symptoms that they're experiencing. And it's great to hear you had mentioned earlier that the diet and removing these foods may not be just black or white, that there may be some layers of gray in there.
Mhm.
Is this an all or none type of a scenario with food?
I'm sorry, I think you cut out for a second, but I heard you. So it is definitely not an all or nothing approach. As I mentioned before, you can't beat yourself up if you accidentally consume something, or you're going on a once in a lifetime like vacation and they have one of your triggers. I'm not going to tell you just stare at the food, like enjoy it. Lean into some of those other remedies that can help with symptom management. Have some of those peppermint capsules that can help with the abdominal pain. Have some ginger tea. I don't know, like have medication if you need it, some gas X to help with relief if you know you're going to be consuming some of those things. And I tell people all the time to like try to give themselves some grace, because the more we hyperfixate on it, I think the higher our stress and our hypervigilant comes around it, and then the worse our symptoms are going to be. So we don't know, like, are your symptoms because of the stress surrounding eating the food or because you ate the food itself? So I always remind people of that as well.
Okay. And you said that food removal might not be forever. And so can you talk a little bit about reintroducing those foods? How does it work and when is this done?
Yeah, so food reintroductions with elimination diets are interesting because they're not that well studied. So I feel like every dietitian does things slightly different. We actually, we're collecting data on the little FODMAP and found huge variations on how people reintroduce. But like a general rule of thumb is that we do need to reintroduce things, right? Like it is important. You cannot stay on elimination diets forever. That is not beneficial, that is not healthy. We need to try to reintroduce things. So generally, I try to do in a systematic approach where you reintroduce a food item for roughly 3 days. And the reason we want to do it for 3 days is because if you do it just one day, again, was it the stress around eating the food? Were there other variables that caused perhaps a flare up in symptoms? Or maybe you don't have any symptoms when you eat it just one time and it's an accumulation of it because of this delayed response that you're having with it, right? Like it's not a traditional food allergy where you're having an immediate response. It's a delayed response. So eating that food for 2 or 3 days leads to you having symptoms on day 3 or day 4. So a 3-day challenge is really a good time frame to see if it is a trigger or not when you're reintroducing it. And I tell people to just help with the confidence level to maybe microdose themselves or do a really small amount on that first day, see how it goes, depending how they feel, then increase to the amount they typically would eat by day 2 and day 3. So we are like slowly increasing it. And if it does trigger you, pull it back out, give yourself a rest for a few days, and hopefully your body will reset, and then you can move on to the next food.
Okay.
Again, this is where a dietitian could be really helpful to help you with like navigating what foods to reintroduce and how.
This is all really helpful. Thank you so much. Do you have, for the folks who are listening, any other resources that you would recommend or sites that they could go to learn more?
Yeah, so there's a lot of great resources out there for IBS patients. I think ones that I lean into a lot would be things like IFFGD, the Rome Foundation, Tuesday Night IBS. I know they do like podcasts, which are always a wonderful like way to learn outside of just reading on things. There are some dietitians in this space that I like. Kate Scarlatta, she is one in Patsy Catsos. Like there are some of the original dietitians in this space that have a lot of wonderful resources and also like podcasts and things in this space as well. If you are following a combination with the low FODMAP diet, Monash and FODMAP Friendly are wonderful resources. Now, if listening to this, you're like, oh, I really need to connect with a dietitian and get more help and more guidance, there are ways to find GI specific dietitians. I mean, if you're working with a gastroenterologist, asking them for a referral, and if they don't have the ability to, that IFFGD website I mentioned does have a directory. So does the Monash website. The AGA, so you can ask your doctor to look on the AGA directory. They are now paired with the Academy of Dietetics, and do have information about GI specific dietitians. So that is another wonderful resource.
Okay, thank you so much. I mean, these are great management techniques. I'm learning that obviously there's no real cure right now for IBS patients and their symptoms. But can you give us kind of some final thoughts on the role of food for how these fit into the management of their ongoing symptoms?
Yeah, I mean, you're right. There is no cure, but I think we have come a long way from where we were 10, 15, 20 years ago with the role of like food and IBS management. I think we know a lot more. I mean, there's so much evidence, like I said before, with the low FODMAP diet, um, and symptom management, but just diet, lifestyle. There are ways that we can really improve someone's quality of life and make their symptoms more manageable, with the help of a care team. So I think that's an important part. It's not just like working specifically with your doctor. I think they're a multidisciplinary approach is really important where you have integrated care with the doctors and the dietitian. They have GI behavioral therapists and acupuncturists that can all help with pelvic floor physical therapy. You know, they can all help with managing, helping you manage your symptoms better and improve your quality of life. I do think that there are more and more being researched on more of these personalized approaches with food. And this is kind of on the horizon. The low FODMAP is kind of the first to dabble in this space. And I think that's like the bottom of the pyramid. And towards the top, we are doing more research on more of personalized approaches when it comes to diet and helping people manage their IBS.
Thank you, Amanda. This is all really great information and super helpful in managing this challenging condition. So we really appreciate the time and your perspective on both IBS, symptom management, all these other topics, and then also on inFoods IBS. So I hope everybody's gotten as much value from this as I have. Amanda, again, really appreciate the time and the insights.
Yeah, thank you for having me.